Following is an accident: client is admitted to a hospital. This type of admission is A. Routine admission, B. Therapeutic admission, C. Emergency admission, D. Accidental admission. And the correct answer is C. Emergency admission. This type of patient is admitted on emergency basis for critical care. Other conditions like poisoning, heart attack, burn, etc. also need emergency hospital admission. The most reliable way to assess the respiratory rate of a client is A. Observe the chest rising and fall. B. Listen and feel the air movements. C. Count the respiration 10 seconds. D. Use cardiac monitor. And the correct answer is A. Observe the chest rising and fall. The respiration rate is the number of breaths a person takes per minute. The respiration rate is usually measured by counting the number of times your chest or abdomen rise over the course of 1 minute. Which among the following electrolytes has to be replaced in client with vomiting and diarrhea? A. Sodium, B. Potassium, C. Calcium, D. Magnesium. And the correct answer is B. Potassium. Potassium is an important mineral that functions as an electrolyte. It helps to regulate fluid balance, nerve signal and muscle contractions. Carotid pulse should be checked for A. 15 to 20 seconds, B. Less than 5 seconds, C. 5 to 10 seconds, D. 10 to 15 seconds. And the correct answer is C. 5 to 10 seconds. Check carotid pulse for a minimum of 5 seconds but no more than 10 seconds. It is to determine if there is pulse present or not. It is important to minimize delay in starting CPR. So take no more than 10 seconds to assess the carotid pulse. Germ theory of disease was propounded by A. Darwin, B. Freud, C. Louis Pasteur, D. Erickson. And the correct answer is C. Louis Pasteur. Louis Pasteur discovers a germ theory in 1861. During his experiments, he developed modern germ theory of disease. He proved that food spoiled because of contamination by invisible bacteria, not because of hypothetical process. Which of the solution is isotonic? A. 0.9% saline, B. Dextron, C. 0.45% saline, D. Dextrose saline. And the correct answer is A. 0.9% saline. A solution is isotonic when its effective concentration is the same as that of another solution. Some examples of isotonic solutions are 0.9% normal saline and lactated rangers. Vastus lateralis is a site for A. Intravenous injection, B. Intramuscular injection, C. Intradermal injection, D. Subcutaneous injection. And the correct answer is B. Intramuscular injection. The vastus lateralis site is commonly used for intramuscular and immunization in infants and toddlers because the muscle is thick and well developed. This muscle is located on the anterior lateral aspect of the thigh. What should be the temperature of water used for cold sponging? A. 98 degree Fahrenheit, B. 105 degree Fahrenheit, C. 90 degree Fahrenheit, D. 0 degree Fahrenheit. And the correct answer is C. 90 degree Fahrenheit. Use lukewarm water, that is 90 degree Fahrenheit to 95 degree Fahrenheit. Do not use cold water, ice or rubbing alcohol, which will lower the child's body temperature too quickly. Do sponging for 20 to 30 minutes. Stop sponging if the child starts shivering. The primary response of a nurse during admission of a client is to A. Orient the client to hospital routine. B. Prepare admission sheet. C. Receive the client in a courteous manner. D. Fill consent form. And the correct answer is C. Receive the client in a courteous manner. In a child with fever, oxygen demand increases because A. Metabolic need increases. B. Blood sugar level decreases. C. Patient is less active. D. Patient is more alert. And the correct answer is A. Metabolic need increases. Which among the following patient's condition the nurse will inform to the physician first? A. Patient who is having pain. B. Patient who is fluctuating blood sugar level. C. Patient after surgery become unconscious. D. Patient with decreased urine output. And the correct answer is C. Patient after surgery become unconscious.